It's on the way. There you
So, great. Okay. Hello, everyone. We had a little informal chat amongst the panel before we started, and I was the obvious Luddite in the crowd, so I'm going to just stick with my my skills of being a Luddite and do some old-fashioned audience participation. So just out of interest, how many of you here are actually already using social media for your work in health? So maybe a third at a stretch. What if you don't use it for your work but would like to? So about the same again, probably, about a third. And how many of you think that what Lee has just presented is nothing short of a revolution if you were to have that at your organisation? So does that mean the rest of you, so probably half of the room, don't see it as a revolution? Does that mean you think it's not challenging, not confronting? Something easy to do or not so different from what you're doing? Any thoughts? To me, it seems like a total revolution, and I think it's one of the revolutions we have to have, not least because, as Lee said, the digital revolution is happening. There's no stopping or turning back, and the public, the wider world, has voted with its feet or keystrokes. The potential benefits for social media in health include, and I think we've had a lot of examples from Lee about its use in marketing a service and having some benefits for patients as well. But I think more broadly, fostering innovation. I see huge synergy between social media and the Gov2 agenda, so the potential for the wider community to value add as co-producers. And in a way, we've seen that happening here with the Twitter stream. It's sort of a great example of how the audience and beyond contributing to the event. And I was just thinking, from the point of view of the organisers, it's a tremendous resource. You've got this record of the event that you otherwise once might have had to pay people a lot of money to do. And as I was checking my Twitter feed as the event was unfolding, people were tweeting there's actually, the ACT government is having a virtual cabinet meeting today that people are tweeting about. So I think it's an example of how this revolution is happening in all fields. Other potential benefits I see are breaking down some of the silos and hierarchies within and between organisations, professions, bureaucracies, the various sectors, in assisting change management, challenging power imbalances in the sector, creating greater transparency, creating broader communities of interest, and an example of that already here we are, people in health interested in social media, and one of the people who chimed in on the Twitter board there, Jenna Price, is a journalism academic in Canberra, so she was engaging with this discussion, so someone from outside healthcare having the opportunity to do that they wouldn't have before. But clearly there are huge barriers to this happening, and I know Cliff has told us to be positive and not focus on the negatives, but I think we do need to acknowledge that there are a lot of barriers, and if you reflect upon what Lee has presented and his vision and what that might mean for your organisation and how it works, I think some of those barriers come to mind quite quickly. They could be cultural, they could be organisational, to do with resources, capacity. I think one of the challenges is to look at the organisational level, what can facilitate the vision, what type of people can be empowered to drive it. And I've been a little bit naughty. I know we're meant to be focusing on healthcare, and I know Hugh will be doing that. But I'm going to take the opportunity. Croaky blog, if you read it, you know, sort of tries to focus on underserved areas and issues, and you know, bangs on quite a bit how we have so much focus on hospitals and so on. So I'm just going to try and broaden the focus on social media and health a little bit. I'm just going to quickly pitch you 3 ideas on how social media could be used to advance the population's health. So the first one, this is Healthwatch. There's plenty of rhetoric about the need for a broader focus to health policy and for more concerted action on the social and broader determinants of health. But how to make this happen? Maybe social media could help. As a journalist, I find Twitter an invaluable source of related material from around the world. It provides a constant stream of useful news in this area that hardly ever hits the mainstream media headlines. The social determinants of health have an active Twitter-based lobby, and social media is enabling the extension and strengthening of networks in this area. So this suggestion is to set up Healthwatch, Watch, a social media campaign to highlight the health impacts of broader policies. I spent this morning, for example, on the phone doing interviews about mental health reform, and this is a glaring example of why such a campaign might be useful. In recent times, there have been headlines about problems with domestic violence, problems with child protection, and the lack of support in schools for young children struggling with developmental delays and other such problems. Healthwatch could help highlight the health implications of such problems, and perhaps they'd be more likely to get some attention and resources and action if they were reframed as a health issue. That's one pitch. Here's my next one. Primary healthcare focus, our health. So one of the many unknowns of recent health reforms is how Medicare locals will play out. The concept seems to provoke great hopes, expectations and cynicism in equal measures. Long term, perhaps there are opportunities for Medicare locals to engage with their communities in much more honest and open debates about health, the factors that contribute to community health, the inequities in health and the allocation and the returns of health spending. Our health, and please note that this is not called My Health in the way of the unfortunately named My School or My Hospital initiatives, our health is not about broadcasting health information, as has been the tradition of most health agencies, but about a two-way exchange of expertise and information. It would tie in neatly with the Gov2 agenda, which acknowledges the potential of the wider community to value add for both public and for commercial gain when government processes are opened up and data is made more freely available. So my third pitch for the latest news and analysis. And I was thinking, once upon a time, a suggestion to establish something called the S&M Times might have had very different connotations. As someone who specialises in covering health, it's impossible for me to keep up with the rapid pace of development in social media and health. It's an exponentially expanding field. So I suggest that a four-sided organisation or individual could do a great service to the sector by seeding the Healthy SM Times to provide independent news and analysis of developments in social media and healthcare. It's timely that we're having the event while the media inquiry is underway, and I don't know if any of you saw Stephen Mayne on the news last night, who made a presentation to the media inquiry, and he made a suggestion that once would have just seemed pie in the sky, but with the changing nature of the landscape, doesn't seem so ridiculous, and which is that governments should start funding watchdog websites that hire journalists to do watchdog functions on, for example, local councils, you know, a hugely underreported area. So, you know, the whole idea of other sectors stepping up and helping to fund watchdog journalism is not so far-fetched as it once might have been. Anyway, those are my three quick pitches. They're a result of a very brief one-on-one brainstorming session. And to me, you know, just there's so much potential out there in this field. So if you put a lot of people together brainstorming, who knows what you could come up with. I was delighted to hear of this symposium because it has been my impression that the health sector has been slower than some others to engage with the potential benefits of social media, framing it largely as a risk management problem rather than a potential health booster. Perhaps the Royal College of Nursing's recent social media guidelines, which acknowledge the potential risks but equally stress the potential benefits, may signal that a sea change is starting to occur, and hopefully the symposium is a sign of that as well. So thanks very much, and over to Hugh.